home, but you could use like a coat hanger or something, like a coat rack, and hang it high in a closet. Gravity, like I said, is your friend. If the higher you can get it, the quicker it's going to go. When we put it into the animal, you'll see a nice stream right here. If it's just dripping, it's going to take longer. So obviously she's a little squirrely and doesn't want to do this. So hopefully this part goes well. When you go to put the needle in, you make like an approach like this. You make a tent. I don't know if you can see that there. But you go into the tent here when you poke the animal, right there. Before you poke them, you want to measure or see where the bevel is. See how the sharp part goes this way. If you use it against the skin this way, it's going to be easier on them. If you go this way, it's going to be more traumatic. Right. Does that make sense? Yep. So you just make the tent, figure out where you're going, and then let it go. And just, it's already in there. It's not a big push. You don't have to push really hard. It doesn't feel bad. It just kind of, as long as you use a fresh needle each time, it's gonna work out. Here's your little wheel. You control the fluid amount. You can see it dripping there. We're going from here to the 200 mark is where we're headed right now. We're gonna do 200 mLs every week is what she has you working on. You can see how it's dripping slowly. If you adjust it just a little bit, sometimes you can get it to go a little bit faster. When I say adjust it, it just kind of makes sure the needle's not pushing against something. So it's going a little bit faster. That's the perfect stream right there. You want it to go that way. Having somebody hold their hand on the animal is helpful. If she wants to keep escaping from you, clothes baskets can work. That way you're containing her. You know what I mean? You kind of have a higher edge so that she can't just keep getting away. She's doing really good with just us having our hands on her, but sometimes when you're in your own situation at home, it's a little bit of a different experience because it's her territory. Here she's not in mine. So she's not crying. That's a good sign. A lot of the time people report they see immediate response even the next day. They're like running around and feeling frisky. So that's what I said, it can make them feel better. It doesn't necessarily cure it. It just helps maintain them. And yeah, that's what we're trying to do right now. Prolong it, I guess, and essentially, but in a good way by keeping her comfortable. So when you go, sometimes the bag will suction down and it can be hard to measure exactly. But we're trying to go to the 200 line. Do you see what I mean? How it's kind of flattening out and it's hard to say. Yeah. If you can kind of feel the bubble that we're making right now. Yeah. That's probably about a 75 mLs already. So we gauge it with our feeling too. You know what I'm saying? As time goes, this little bubble will gravitate down into her chest area and kind of look a little saggy. That's normal. Okay. So when you're done, you basically just turn the wheel off, take the needle out. Sometimes it'll leak a little bit, so I like to put my finger where the spot was just to hold it, because cats don't like to get wet. You know, the drier you can keep it, the more comfortable you can keep it, I think the better the outcome too, for you guys and trying to do it at home.
Are you holding it down with your finger?
Not really, no. I have my hand just kind of, it's in there, and I'm just resting my hand against it so it doesn't slip out. She's doing so good about holding still. I think she's, you can see her twitching her skin. She's like, I feel it. Good kitty. He's okay. She's handling it really well. Yeah, I don't know how bad it was. It sounds like her kidney failures are pretty bad, but because Dr. Schneider wanted her to go to the emergency room to get them flushed, just to kind of get her started on this. That was the idea, but I understand the cost can add up quickly.
If we decide to do that next week, would that be fine too?
It's not going to hurt her. It would make her feel better a little bit quicker, but remember, it's not going to reverse it. It's just going to try to make it manageable. So again, the bag is kind of sinking down a little bit, and it's hard to read exactly how much you've given, but if she starts getting to the point where she's moving around and feeling uncomfortable, that could be your skin getting too tight. And when you're at this point, I would just, discontinue, because it seems like we've got a good amount in her. I'm going to keep going right now because she's not complaining. You're not complaining, huh?
Her tail's still wagging.
Yeah, sometimes, well, it's kind of a relaxed wave. It's not much of sometimes they start whipping it. That's when they're really mad. Another trick that you can do is add air to the bag. I think I'm going to do that for you because it's like going down so tight. And I feel like that's a good amount for her. Let's measure it. I have to stop and, so as you turn the wheel off, you take the needle out and you put it right here. See the drips that kind of happened? Some of it happened, but that's pretty normal. She doesn't seem to be acting like it's painful, so that's a good sign. But as far as this bag suctioning down, you won't have to do this again. I'm just doing this to make it easier to add a little air to it. And it makes it easier to see. See, we're right at the 2. So that was, I don't know how I did that. Magic.
Oh, I see.
I'm just kidding.
That's pretty awesome.
That was
I
for
mean,
your demonstration. The funny part of